We have a health alert for parents tonight. An illness that can put little ones in the hospital is moving closer to the Midwest. KCTV5's Abigail James has this warning on RVS and how parents can spot it.
RSV is already spreading across the East Coast. Doctors here at KU Med say they're not seeing any cases yet, but they will be soon. Respiratory syncytial virus, or RSV, is a dangerous illness that affects children from 2 months to 2 years old. University of Kansas Health System's pediatrician Dr. Michael Lewis says in the beginning it has signs and symptoms similar to the common cold.
A lot of times those kids might have a little bit higher fever than your average cold. They have a lot of mucus in their nose typically. That's one of the hallmarks of RSV.
He says it can happen to any child, though it affects some children more than others.
Kids who have been born premature, kids who have any heart conditions or an underlying lung condition, those are going to be the ones, as well as, like you said, the ones who have a history of a lung issue. Those are going to be the ones you're most at risk for to have complications.
Lewis says in some cases, RSV can lead to bronchiolitis, which is not the same as bronchitis.
It produces a lot of mucus down in their lungs, and so you get a pretty wet cough for little infants. Those are the kids you need to be the most concerned about, is probably the kids who are less than 6 months of age.
Lewis says hygiene is the best prevention from this contagious illness.
If we have good hand hygiene at school and daycares and at home, we have the opportunity to probably decrease its spread because it is very contagious.
Now RSV tends to pop up in the Midwest in December. It typically lasts through March. For now, reporting in Kansas City, Kansas, Abigail James, KCTV5 News.